In 2023, we covered how oral health impacts your body. In 2024, we looked at how your body impacts your oral health. And now in 2025, we are going to get very specific and talk about how different classes of medications impact your oral health. Welcome back to the channel. I'm one of the co-founders of a platform where we teach people about periodontology and oral health. This entire series is based on recent publications in the peer-reviewed literature. The references are listed here and in the description box below. You can watch the rest of the series here. Now let's dive into the data. Alright, first up, let's start off talking about drugs that cause dry mouth. Many commonly prescribed psychiatric medications such as selective serotonin reuptake inhibitors SNRIs, tricyclic antidepressants TCAs, and serotonin and norepinephrine reuptake inhibitors SNRIs have been associated with xerostomia, which is dry mouth. We know that SNRIs are widely prescribed to manage depression, anxiety disorders, obsessive-compulsive disorder, post-traumatic stress disorder, among others. TCAs are used for neuropathic pain and other psychiatric conditions, and SNRIs are often prescribed for chronic pain and depression. What's concerning is that the prevalence of xerostomia due to these medications can be significant. For example, studies suggest that about 23% of patients on SNRIs develop dry mouth, 40% of those on TCAs, and nearly 36% on SNRIs. But it's not just about the numbers. Dry mouth has serious implications. People who experience dry mouth often struggle with issues like difficulty speaking, swallowing, tasting food, and even reading. It also makes it harder to use dentures if someone needs them. Beyond these challenges, dry mouth is a gateway to other oral health problems. When the mouth doesn't have enough saliva, it becomes more acidic, which raises the risk of cavities and worsens gum disease. And as if that's not enough, these medications can also make things worse. They can affect your sense of taste, making food less enjoyable, and they can lead to something called gingival overgrowth, which means the gums can become thick and swollen around the teeth. This can not only make your smile look messy, but can also make it harder to clean your teeth properly. So for patients and providers, the question becomes, how do we balance the benefits of these medications for mental health with the potential negative effects on oral health? This is a complex issue, so if you or someone you know is facing this challenge, it's important to have open conversations between the patient and their provider. Alright, moving on, let's talk about drug-induced gingival enlargement or DIGE. This condition happens when certain medications cause your gums to grow over your teeth. While it's most commonly associated with pregnancy, it can also be triggered by several types of medications. Calcium channel blockers, particularly those used to manage high blood pressure and angina like amlodipine, studies show that around 10 to 17% of individuals taking these medications might experience gingival enlargement. However, it's not inevitable. Research suggests that factors like poor plaque control might increase the likelihood of developing DIGE. So good oral hygiene could be a game changer. Other medications known to cause DIGE include anticonvulsants like phenytoin used for epilepsy and other seizure disorders, as well as immunosuppressants like cyclosporine and tacrolimus, which are crucial after organ transplants. Interestingly, studies suggest that genetics might play a role in determining how severe the gingival overgrowth can become, particularly for those on phenytoin. Some studies suggest that lower folic acid levels might also contribute to more severe overgrowth, and there is some evidence that taking folic acid supplements might help prevent it. However, the exact causes of DIGE are still being researched. If you are experiencing this, don't hesitate to talk to your dentist. They might suggest strategies like improved plaque control, possible adjustments to your medications in collaboration with your prescribing physician, or in persistent cases, they might recommend a gingivectomy to remove the excess gum tissue. Alright, next up, let's discuss the relationship between medications and the risk of gum disease, specifically chronic periodontitis. Remember that chronic periodontitis is a long-term condition that causes gums to pull away from the teeth, creating pockets that can become infected. These infections can spread to the bones supporting the teeth and can even lead to tooth loss if left untreated. Recently, researchers conducted a large retrospective analysis using data from the Big Myth Dental Data Repository. They looked at almost 7 million adults with nearly 15 million person-years of follow-up time. What they found was that use of anticoagulants like warfarin and apixaban, ACE inhibitors commonly used for high blood pressure such as lisinopril, and statins used to control cholesterol like atorvastatin were all significantly associated with periodontitis. Importantly, these associations remain strong even when controlling for other factors such as hypertension, glaucoma, and mental health conditions. While the study suggests a link, it cannot prove causation. The increased risk could be due to the drug's side effects, the diseases they treat, or even other shared risk factors. Further research is needed to untangle these complex relationships. However, understanding these associations is crucial because it can help guide preventive measures. For instance, regular dental checkups might be more important for people on these medications, and working with a pharmacist to review medications might help uncover alternative options with fewer side effects. Now let's shift our focus to the therapeutic potential of certain drugs. Specifically, we're going to explore two areas: host modulation and senotherapy. Let's start with host modulation. A drug like metformin, which is commonly used to manage type 2 diabetes, has shown some interesting effects in periodontal therapy. It seems to modulate inflammatory pathways and improve tissue outcomes. This suggests that metformin could be more than just a glycemic control agent. It might be a valuable tool for oral systemic preventive care. Now let's talk about senotherapy. This approach targets cellular aging, and in the context of periodontal disease, it holds some promise. A study published in the Journal of Dental Research in April 2025 investigated the effects of dasatinib, a drug used for certain cancers, and quercetin, a natural compound found in fruits and vegetables. When combined, they showed a remarkable effect in reducing gingival cell senescence, inflammation, and alveolar bone loss in animal models. While this research is still in its early stages, it offers a fascinating new direction in the fight against periodontal disease. Finally, let's delve into a topic that's both intriguing and potentially groundbreaking. Several studies published in 2024 and 2025 highlight the surprising connection between periodontal therapy and diabetes management. You might be wondering, what does treating gum disease have to do with diabetes? Well, quite a lot. A meta-analysis published in Frontiers in Clinical Diabetes and Healthcare in 2025 found that scaling and root planing, which is a common gum therapy, significantly reduced HbA1c and creatine protein, a marker of inflammation, at 3 and 6 month follow-ups. What is striking is that these reductions were comparable to, or in some cases superior to, those achieved with pharmacotherapy alone. Another study published in the same journal in 2024 arrived at similar conclusions. Their findings underscore the potential value of periodontal interventions as an adjunctive treatment for glycemic control. So for patients with both periodontal disease and diabetes, this opens up exciting possibilities. It suggests that treating gum disease might not only improve oral health, but could also benefit overall health, potentially reducing the need for medications or allowing for a reduction in dosage. However, more research is always welcome. Larger, longer-term studies are needed to confirm these findings and explore any potential mechanisms. Okay, before we wrap up, let's take a moment to talk about some of the key themes that emerged from our deep dive into the latest research. First, we saw that certain medications can negatively impact oral health. For example, many psychiatric drugs can cause dry mouth, which can lead to other issues like cavities and gum inflammation. Certain drugs can also lead to gum overgrowth or increase the risk of gum disease. Second, we explored the flip side of this coin. Some medications hold therapeutic promise for oral health, drugs like metformin, and the combination of dasatinib and quercetin show potential in managing gum disease by modulating inflammation and targeting cellular aging. Third, we uncovered a fascinating link between periodontal therapy and diabetes management. It's incredible to see how treating gum disease might help control blood sugar levels, potentially reducing the need for diabetes medications. So what does all this mean for us? As we wrap up our discussion, it's clear that the relationship between our medications and our oral health is intricate and multifaceted. It's not just about what we take, but also about the potential impact on our overall health. Stay tuned for more insights on maintaining optimal health in 2026. Thanks for watching, and remember to stay curious about your health.